welcome to the podcast series Addressing DMD Time to Diagnosis Through Dialogue and Education with Pediatricians. Today we are talking with Dr. Crystal Proud from Children's Hospital of the King's Daughters.
I'm Dr. Crystal Proud, and I'm pleased to discuss today early symptoms of Duchenne muscular dystrophy. Duchenne muscular dystrophy symptoms can be readily assessed in the clinical office. And one of the items that can be very telling is the inability for a boy to jump. Sometimes this is noticed by the family, and they will readily report this to the clinician that they're seeing. Sometimes it is noticed by others, such as if they're in elementary school, the physical education teacher might actually pick up on it, or even the teacher in the classroom. When a boy presents with concerns that ultimately lead to evaluation for Duchenne muscular dystrophy, sometimes this can involve motor delays, but those motor delays don't tend to be profound. In fact, many of our patients actually are able to accomplish independent walking in what we consider to be a developmentally appropriate window. We give children up until 18 months of age to walk independently. But what we find is that many of our boys with DMD, in fact, end up walking independently on the later end of that typical time period. In addition to that, it is the difference in how they accomplish certain maneuvers and more qualitative aspects of how they walk or run or attempt to jump that raises concern that they may have some muscle weakness. In addition, what may be most noticeable is their distinction from their same-aged peers with regard to some of their motor skills. They may be able to run, but typically aren't the fastest and may lag behind others. Once again, this can be picked up on areas like the playground or in the classroom. They also may have a difference in the physical appearance of their gait. They may have a waddling gait or some excessive arm swing. And sometimes this is noticed by the parents. Many times, though, this is first noticed by a clinician who points it out to the parents. And then the parents may comment that, yes, they have indeed actually observed this before. Families may also notice that the boy will have difficulty ascending the stairs. So even if they can go upstairs, they have difficulty with alternating feet. And so they tend to hold onto the railing and pull themselves upward. And if they're not pulling themselves upward utilizing the railing, they may just go one step at a time. Now, this is how young children learn to go upstairs, but typically our kids are able to alternate their feet at some point. And our boys with Duchenne muscular dystrophy typically are unable to be able to accomplish that alternating feat. In addition, in order to compensate for some areas of weakness that they have at the hip girdle, our boys may be noticed to have toe walking. These symptoms, once again, may be noticed at home, but may also be picked up on in a physical assessment by a clinician or in general in their day-to-day activities, such as when they're at school. Another finding that might be reported by families or visible to a clinician is difficulty with rising from the floor. If a boy is sitting, for example, in class, crisscross applesauce, as we like to say, and then asked to stand up, he may turn 180 degrees, assume a widened base, push off on one or both thighs, and walk up himself to be able to maintain an upright posture. And this accommodation is known as a Gower's maneuver. It can be quite subtle early on, whereby the boy may simply assume a widened base and then just push off on the thigh, but it becomes progressively more noticeable as the weakness progresses. Families may notice this as well at home, that the boys have difficulty rising from sitting down on the floor in the living room or some other reason why they may find themselves sitting on the ground. And they may actually mention this in a clinical visit as something that they have observed that has raised concern.
Thank you for listening, and make sure you listen to other episodes in the podcast series Addressing DMD Time to Diagnosis Through Dialogue with Education with Pediatricians.